and it is a late evening here in Houston. And of course, I had a very busy day in the clinic, and that's why I'm coming to you so late in Central Time. It's almost midnight here Central Time, actually 11:36. And what came across my news feed was actually a couple of days ago. Michael J. Fox gave a series of interviews regarding his 30-year battle with Parkinson's disease. Now, I remember Michael J. Fox from Family Ties. Now, I haven't kept up with his later work. I've seen him on a number of Netflix movies, and I know he retired in 2021. And this is about 30 years battling Parkinson's disease, which is quite incredible. However, as I usually do when I talk about different entertainers, athletes, and the like with certain chronic illnesses, I want us to not only look at their stories, which I think is very important, but I'd like to see what we can all learn from this. So, as I get ready to get into the story of Michael J. Fox, I think you're going to get a lot out of this. We're going to talk about Parkinson's disease and related disorders. However, I'd like for you, before we get into this, hit the thumbs up button. If you haven't subscribed to this channel, please do so now and hit the notification button. You'll be getting more information on these insightful topics that I'll be bringing to you on a regular basis. Now, the issue with Michael J. Fox, again, I said 30-year battle with Parkinson's disease. Now, many of you may have heard of Parkinson's disease. You may have heard of other neurodegenerative disease. And what does it mean? But let's first of all look at his story, because I think his quotes and his commentaries about his life can be very insightful for what we can learn about what Parkinson's disease is. And first of all, I want to give a shout out to Michael J. Fox and render my thoughts and prayers to him and his family as he's gone through this major battle. And we'll learn what an impact, I should say, it's made on his life. So first of all, here's an interview he's had with Fox, and he's quoted as saying, "Living with Parkinson's was getting tougher and tougher all the time." So that statement in of itself states the nature of the progression of it. So this isn't a disease state that comes and just sort of stays at one level. You get one level of disease, and maybe it starts with a mild symptoms, and it get progressively worse. And so over this 30-year period of time, his disease with Parkinson, his symptoms with Parkinson's disease was getting progressively worse. I'm in intense pain. Each tremor is like a seismic jolt. It's not so much pain from the movement, but from not moving. It's when you freeze, and that freezing and not movement becomes infused with all this energy, and it becomes this burning, impending thing that never happens. The final thing is that he's broken his hand, his elbow, his humerus, so he's broken many parts of his body, parts of his face. So what we can glean from these interviews is that Parkinson's disease, or his symptoms, are mostly symptoms of motor dysfunction. So before we get into the details of that, I want to talk about what Parkinson's disease is, the basics. And as his testimony outlines for us, it's related to uncontrollable movements. It's related to difficulty with balance and coordination. Now, I don't like to talk about disease states individually. So what I'd like to do is step back and talk about Parkinson's disease as it relates to other type of disease states. Now, what is Parkinson's disease in general? It's part of a class of diseases known as neurodegenerative disorders. Now, neurodegenerative is a big word, but neuro means nerves or brain-like tissue. Degenerative means breakdown. So breakdown of nerves and brain-like tissue. That's what neurodegenerative disorders are. So if you think about them, you may have heard of these. You've heard of Parkinson's disease, and we're talking about today. Most of you have heard of Alzheimer's disease, I'm sure. Many of you may not have heard of Huntington's disease. Many people have heard of amyotrophic lateral sclerosis. It's also known as Lou Gehrig's disease. There are other types of general motor neuron diseases and multiple sclerosis, to name a few. So these are classes of neurodegenerative disorders. Why I like to talk about them as a class as opposed to isolate one disorder is that we can talk about them as a class because they all have some fundamental similarities. And the similarities here, these are chronic breakdown of nerve tissue. Most of the time, it's related to the central nervous system. If we take the two most common, Alzheimer's and Parkinson's disease, that's why I had those highlighted in red in the previous slide. These are the two most common neurodegenerative disorders. So what I'd like to do is compare these two. So it's really a tale of two diseases, two brain disorders. So what is Alzheimer's disease? Essentially, Alzheimer's disease is given age-related, but in Alzheimer's disease, there's a loss of executive function. That means your ability to think, your ability to remember things, your ability to know your name, who you are, to carry out higher brain function. Parkinson's disease is predominantly motor signs. Now, as we gain from the interviews of Michael J. Fox, as we discussed earlier, we understand that he had motor problems. And one thing we can take from those interviews is that his sentences were pretty much intact. The other thing we know about Michael J. Fox, despite that he had a 30-year battle with Parkinson's disease, he continued to work, he continued to act. And working as an actor requires higher levels of executive function. So his levels of executive function was intact, but his motor skills were impaired. Those of you who know about Alzheimer's disease patients, people with Alzheimer's disease, typically they can move around, but their executive function, they don't have the ability to remember things. They can't make decisions. So this is important. It's an important differential. And if you look at a diagram of the brain, and I'll enlarge this a little bit for you. If you look here, this is near the brainstem. This is where the disease state for Parkinson's disease affects us, as opposed to Alzheimer's disease is in the cerebral cortex. Now, why am I making this differential? Well, the brainstem, or the base of the brainstem and the core part of the brain, those control very basic and fundamental functions, movement, breathing, etc. The cortex of the brain, that controls higher level function, our thinking, our cognition, our ability to do mathematics, our ability to be creative and to be witty, etc. So if that part's affected, our ability to think and make executive decisions is impaired. The fundamental part of the brainstem, if that's affected, that affects more fundamental aspects of our ability to function, such as movement. So essentially, these are very similar disease states with similar disease mechanism. It's just where these mechanisms, where the cell breakdown occurs, affect the outward symptomatology. So what's the disease mechanism? I always like to talk about disease mechanism because it's important. If we just think about a disease state based on its label and we don't understand or think about it in terms of its underlying cause, a mechanism, when I say mechanism, it's saying its underlying root cause, then we, from a clinician standpoint, I'm not going to be able to apply the right treatment. So what do we know about the mechanism? Well, nerve cell breakdown by the following means occurs by excess neurotoxins. So these are toxins that are built up within the body itself, or toxins that are exogenous or come from outside the body. There's a condition known as oxidative stress. So you have an excess amount of toxic molecules compared to the amount of antioxidant molecules. Then there's excess amount of oxidative stress. Increased cellular inflammation. Inflammation is like a biochemical fire. Mitochondrial dysfunction. The mitochondria are the organelles inside the cells that make ATP, which are the energy sources of the cell. So if they become dysfunctional, the cell becomes dysfunctional because it doesn't have its normal energy source. Abnormal cell breakdown. So you have protein breakdown that causes misfolding, and these become toxic molecules. Endothelial is the inner lining of the blood vessels. They become dysfunctional, and you have vascular abnormality or poor circulation. So these are common breakdown mechanisms of all these neurodegenerative disorders, and therefore they have a common denominator in how they misfunction. And this common denominator is only differentiated by where these mechanisms occur, whether in the case of Parkinson's disease in the brainstem, in the case of Alzheimer's disease in the cerebral cortical areas. However, these very similar mechanisms, disease, they occur in other tissues too. So just because these mechanisms are causing neurodegenerative disorders, these are the same mechanisms that cause cardiovascular disorders, cause endocrine disorders, cause musculoskeletal disorders. So when we think about disease mechanism, even though in medicine we outline certain disease mechanisms, we think of them as separate entities. These are really one and the same. So I see that some of you in the chat, I don't know what part of the country you're from, but there's a number of people in the chat. Hello to all of you. And so sending family prayers and God blessing. Thank you very much. Sri Caldwell, believe he took medicine for a long time, then decided to stop. It seems side effects were terrible. What are your thoughts as a physician? Now, that's a great question. So she's asking about Sri Caldwell, said he took medication for a long time. The side effects were terrible. And what are your thoughts as a physician? So it seems like you're reading my slides ahead of time, Sri, because, and I hope I'm pronouncing your name correctly, Miss Caldwell, I'll say, because medication surgeries. So why did he take medicine for a while and then stop? Well, medicine has minimal effects on symptoms, okay? They have short-lived benefits. So early on, you take medicine, you may suppress symptoms for a short period of time, but it doesn't last long. Why? Because it does not prevent progression of the disease. And also there's limited by numerous side effects. So the side effects of long-term use of the medications prevail over its benefit. So if you think of it this way, you start taking the medication, you start to cover up some of the symptoms early on. However, you're not stopping the progression of the disease. So over time, the disease itself is getting worse and the medication is not stopping. That's one. Two, the medication, which has minimal effects on suppressing symptoms and no effects on suppressing progression of disease, it over time is starting to cause a problem too, because medication taken over a long period of time cause side effects because it has an adverse effect on the liver, the kidney, and other parts of the body. So you have to stop taking the medications. And of course, there are few surgeries that have been shown to be beneficial for Parkinson's disease. But these standard therapies have minimal to no benefit and essentially no benefit over time. So what are my thoughts? Well, the therapeutic effects of lifestyle intervention comes to play here. Optimal nutrition, exercise, proper hydration, and rest have the following effects. They reduce inflammation, they improve mitochondrial function, they improve endothelial function, and they enhance vascular function and circulation. And we do know that these lifestyle interventions, so they're physician, and we have in our experience patients who with some neurodegenerative disorder, Alzheimer's early on, we suppress the progression of that disease. We know with just optimal nutrition. We've had patients with MS in wheelchairs get up and walk and function better. There's a great story if you want to look at the docuseries Code Blue, the docuseries Code Blue. There's founded by a physician, Dr. Sarai Stancic, who's a physician who was diagnosed with multiple sclerosis early in a medical school training. And she learned about proper nutrition with plant-based diet and exercise and sleep. And she got to the point where she was on a walker and almost in a wheelchair. And then she got to the point where she was running marathons. And so she chronicles her journey in defeating multiple sclerosis. And there's hope for treatment of Parkinson's disease with other modalities. And so they're promising new therapies. Now, I'm not going to get into the details of these promising new therapies tonight, but what I will do is outline them. So infrared light therapy, we use infrared sonotherapy in our practice. We use their benefits for patients with Alzheimer's disease. There's some research that shows some benefit for patients with Parkinson's disease. Systemic ozone therapy has promising research data. We're using ozone therapy in our practice for many chronic illnesses. We don't have patients with Alzheimer's disease that we're treating as of yet. And there's also data showing some promise for mesenchymal stem cell. But I want you to stay tuned. We will be talking about each of these therapies and the general health benefits of these therapies, because these are looming hopeful interventions. And there's a lot of data showing the benefit of each of these therapies in cardiovascular disease, certainly with infrared light therapy, ozone therapy, and stem cell therapy. Patients with advanced heart disease, et cetera, can show benefit. So, key takeaways. Number one, Parkinson's and Alzheimer's disease are fundamentally the same, affecting different parts of the brain. Okay. And so we want to think of them as similar diseases that affect the brain in a similar disease affect the brain in a different way because they affect the brain in different locations. The other takeaway is that Parkinson's results in motor dysfunction, so it's a moving disorder. Alzheimer's disease is a disease that affects executive function, so it's a disease of thinking disorder. Medications and surgeries have limited to no benefit, and lifestyle interventions and other integrative therapies have shown some efficacy and have much promise. So if you have this disease yourself, if you have a loved one with this disease, or if you think you're at risk for one of these diseases, first and foremost, the simple thing you can do on your own is start to make lifestyle changes. And that works from the standpoint of preventing disease, but also if you have early forms of these diseases, it can probably halt the progression. You can simply make change in your lifestyle with diet and exercise and proper sleep. And as always, in the notes of this and the description of this show, I give you information on our website. We give you an overview in terms of some basic things you can do from a lifestyle standpoint. There's a free video, Jumpstart information, and I'll be updating that video very soon. So there's a lot of information there that you can do. And also, wherever you are, you can find a functional medicine doctor or a regenerative therapy doctor and inquire about some of these new therapies: infrared sauna therapy, ozone therapy, and also stem cell therapy. So stay informed and stay powerful. This is, in this day and time, we're all going to have to become our own healthcare experts. I'm here to try to help you do that. We will constantly bring you information, insightful information about chronic illnesses in general. But more importantly, we're going to give you information and tools in terms of things that you can do to maintain and optimize your health. So until next time, take care. Sorry we came in so late. Those of you probably on the East Coast, you're probably fast asleep, but hopefully you'll get this recording on your notification tomorrow. Those of you on the West Coast, you're probably just getting ready for bed. And those of you in Central Time, you're probably in sleep, where I probably need to be as well. But the work goes on. Until next time, take care. Thank you very much for joining us.